Welcome back, folks. Secretary of Health and Human Services Robert F. Kennedy Jr., a well-known anti-vaxxer who recommends ingesting bleach to fight off COVID-19, has some bizarre reasoning to explain, or no rationale whatsoever to explain, why he disapproves of gender-affirming healthcare for youth. We have this commentary from Alex Bollinger from LGBTQ Nation to shed some light on this topic. RFK supports kids going to tanning salons, but not getting gender-affirming care. Why? Health and Human Services Secretary Robert Kennedy Jr. took some time off from trying to ban gender-affirming care for trans youth, something all major medical associations support because the scientific literature says it's the safest, most effective way to treat gender dysphoria, to stop a proposed rule that would have banned kids from going to tanning salons. To understand why Kennedy is now apparently pro-melanoma, one would have to go down a rabbit hole of conspiracy theories about tanning and learn about fun and unscientific claims like sunblock is actually what causes skin cancer, and that people can build up a solar callus that protects them from the sun, even though experts say that the signs of such a solar callus are, in fact, the signs of sun damage. Several countries and 19 states have banned people under 18, and in some places, adults, from indoor tanning salons. And dermatologists say that those bans have saved lives. Dr. Clara Curiel-Lewandowski of the Skin Cancer Institute of the University of Arizona said that she has seen the results of youth tanning when she has had to treat people in their 20s and 30s for advanced melanoma. There's a lot of regret. Regret for not knowing more, for not getting more help to understand the threat, she told the LA Times. This is an age group that has a very hard time assessing risk. At that age, they don't view carcinogens as a real threat. Kennedy's tanning beds for tots move comes just as ProPublica reports that an increasing number of parents are refusing vitamin K shots for their newborns, something pediatricians have recommended since the 1960s. Babies who don't get the shot are 81 times more likely to develop severe bleeding that can drown their brains in blood. At issue is a right-wing misinformation campaign about the shots, which has been promoted by people like podcaster Candace Owens. She blames Big Pharma for wanting to take money off the shots, but assures listeners that their babies don't need them because it's not true that God designed us wrong. What gets me about all these examples, the tanning beds, the gender-affirming care bans, the vitriol about vitamin K, is just how formulaic it all is. You know that thing that scientists and doctors say is good for your health, or at least neutral? Well, it's actually terrible for you because, reasons, or some such thing. Or something that's generally agreed to be bad for one's health gets labeled a miracle cure, seemingly as a knee-jerk reaction against people saying that it's harmful, like ingesting bleach. This applies most famously to vaccines and gender-affirming care for trans people, but also to masking, pasteurization, antidepressant medications, Wi-Fi and 5G, water fluoridation, non-caloric sweeteners, seed oils, etc. If cigarettes weren't already illegal for minors to purchase, it would be impossible to ban them now. It can feel like there's little rhyme or reason here, but there is one common thread: affirming people's instinctive resistance to changing their prior beliefs. People don't like needles, so telling them that scientists are lying about the effectiveness and safety of vitamin K shots or vaccines is just telling people what they want to hear so that they can give themselves permission to ignore the experts. People are also fairly uncomfortable with gender nonconformity, especially among children. So telling them that there is a conspiracy of doctors trying to forcibly transition children for profit allows them to tell themselves that no, they aren't full of hate. They are actually questioning power structures. You will always be able to find someone who sounds confident to say what you want to hear. And because of the nature of scientific inquiry, there will always be at least one study that can be interpreted to support whatever you want to believe. Scientific progress comes after dozens of studies point to a certain general idea being true. Then comes wading through those studies, evaluating their methodologies, doing the necessary statistical analysis, and weighing them against one another. All of that is work, and not just work, but work that requires years of training and expertise. Such expertise is organized and underwritten by established institutions. That's the heart of what the MAHA, or Make America Healthy Again movement, is against: institutional power, or at least what they interpret as the bad kind of institutional power. They can find confident-sounding people like Owens who will make a profit by saying what they want to hear about vitamin K shots. And they can find a random, poorly designed study from 20 years ago that says that sunscreen causes cancer, share it amongst themselves, and use it to build up another sort of callous, the callous against the truth. Evaluating a body of scientific literature is difficult, and the do-your-own-research crowd is not equipped to, well, do their own research. But they are capable of sharing thin evidence among like-minded people so that they don't have to listen to the actual experts who know things. Sure, people with no scientific or medical background end up holding up one study as they scoff at actual experts, people who work for universities and the government and public health organizations. But that in itself can be the payoff they need. It's not that the medical establishment has expertise. It has institutional power, and people love telling themselves they are the David standing up to a Goliath like Big Pharma. The fact that MAHA types don't have any expertise and therefore can't qualify for the jobs that require expertise is proof enough for them that they're actually right. It's a narrative that we like to tell ourselves, that one lonely voice spoke out against a false consensus and changed the course of history, like, say, Galileo did. Well, that does happen sometimes. It's rare. And the thing is, back in Galileo's time, the tools to conduct scientific studies didn't exist as widely as they do today. Reality is usually much simpler. The person who just learned that epidemiology is a field 2 days ago, telling the medical establishment the vaccines don't work because they watched a poor quality YouTube video made by some guy in his basement, is just plain wrong, and there's nothing more to it. One would think this would all be turned on its head now that MAHA has ultimate institutional power in the U.S. Its leader is the Secretary of Health and Human Services, the most powerful person in the country when it comes to regulating healthcare. But these are the people who voted for a literal former president because he's not a real politician. It's about vibes, not facts. In the end, that's what matters most to these people. The vibes of their kids going tanning feel right. A lot of these parents probably can tan themselves without any real understanding of the risk. But the vibes of gender-affirming care feel off in a society that puts a lot of pressure on people to conform to the stereotypes associated with their sex assigned at birth. Stereotypes that are forced on people before they're even born. And well, now they have the backing of the U.S. government, which takes the same positions they do in defiance of the scientific establishment. As such, they don't have to question their prior beliefs. For people who don't like to be told that their beliefs are wrong, people who very much dislike the uncomfortable feeling of uncertainty and dislike even more the required work to correct false notions. That's all they need. We're going to take another break. When we return, Chris Hayes examines President Trump's Truth Social posts about the war in Iran and what a tragic mess they are. Confusing, contradictory, and costing taxpayers billions of dollars, to say nothing of the lives lost. We'll be right back after these messages.